Hello, everybody. Welcome to Rage and Love, where we passionately debate, explore, and review topics about religion, science, and history. Today, we're going to talk about a pretty serious topic, so I have to give a trigger warning before we start. We're going to be discussing mental health, childhood trauma, depression, anxiety, self harm, thoughts of taking your life and such. So if any of these topics are too much for you at any time, we absolutely understand if you have to step away. First, we want to say we're going to introduce a guest today. It's not going to be just the two of us. And so please welcome our friend, our good friend. It's actually one of Joey's oldest friends from their whole life. This is Anthony.
Hi,
Hey, Anthony,
how's it going?
welcome. Doing good. Welcome
Welcome.
to the show. Welcome.
Hi, nice to be here.
So, as AJ was discussing on during the opening, we're gonna probably go into some pretty deep topics on mental health today. Um, we feel like these are topics that a lot of people kind of avoid talking about, but I think everybody actually does deal with them. Mental health is something that's very complicated. Everybody's um, what's the word I'm looking for? Everybody's different in terms of what they're dealing with, what they're going through, and what they have as resources to help them, and what they use to try to cope and actually be able to deal with their mental health. Um,
Yeah,
AJ, what would you like to talk
Yeah,
about first?
I think that you know a good place to start is to understand that the way that we are is not a choice. Like nobody can choose to be depressed or to feel anxiety or even to stop doing those things. You can't just one day wake up, oh, I'm gonna stop being depressed. Today I'm gonna stop being anxious.
yeah,
So a lot of people when they go to therapy, unfortunately, what they're faced with is a treatment that handles behavior, and it doesn't actually deal with the root cause of what's causing the behavior. And I think that's a really big mistake that a lot of therapists make in how to deal with people's anxiety and depression and addiction, and that's why it continuously keeps coming back, right? Like we go and seek treatment, and they're just like, oh, well, we're just gonna give you a bunch of pills so that you'll behave better, so that you'll stop being anxious, but they don't actually deal with what caused that anxiety from deep
yeah,
down, right? So I think that I don't know. I guess we could start with sharing our own personal experiences because I think all three of us have had pretty extensive experience with all of these that I mentioned. Depression, anxiety, self harm, even addiction. So
yeah.
so Joe, do you want to get started with that? I guess.
Yeah, I can go first and just talk about it, and a few things that I've dealt with in my life. Definitely, I think within the last couple of days, as I've been kind of like going in a little bit deeper into my past, there's some things that I now realize are probably shaped a lot of actually shaped or formed a lot of the issues that I deal with now as an adult, or even through my 20s, with my anxiety, my social fears, um, feeling of always being judged, not liking to be in large crowds, kind of just wanting to be a loner in some stance, and having a hard time accepting new things into my life. um, I'm not sure if all of those things stem from my childhood, because my childhood was not actually horrible.
Yeah.
I mean, I didn't have a horrible childhood. I had a good family.
Well,
My mom, my
do
dad.
you feel like I always felt that it stemmed from a lot of kind of it was kind of like a neglect that came from just being like put in front of a computer all day. because I started with like Atari, and that's kind of like what raised me. Was I feel like some of those things come from that.
Were your parents not giving you attention, you mean, right? Were you kind of
Yeah, well, my dad worked a lot,
yeah.
and my mom was at home and in pain and neglected, and she kind of just masked herself and hid herself in the room, and I was just there, and I raised myself kind of. So
Yeah, that's understanding, and I could see that. I mean, I recently was watching a video. I don't remember the doctor's name or the person who was talking. The video that you showed me earlier, AJ,
Mhm.
about um, the gentleman that was discussing how babies, when they're neglected, even though they can't remember that, their brain still forms a reaction to it of not being
Yeah, I
cared
can probably
for
explain that. I can
a
probably
little bit
go
better.
into that a little bit. So, who you're talking about is Gabor Mate, and he's
That's
a,
it.
neuroscientist and psychologist, and he has like decades of experience, and everything that he puts out there is based on scientific research, and it's not just like opinion, and it's not something that I'm just kind of making up, right?
yeah,
So what he says is that studies have shown that the way that our brain becomes wired to know how to respond with things happens before the hippocampus develops, which is the part of the brain that deals with storing memories.
yeah,
So what happens is when our body stores certain memories, then we develop a way of responding to that. But so before we are even able to develop these memories, we're not going to remember all that stuff. Like that's why hardly anybody remembers anything before they're 5 or 6 years old. Like your first memories are probably from around that age.
yeah,
um, However, what he says is the studies of blood work, of brain scans, of all this have shown that people, while the memories are not being set as a long-term memory, they're leaving sort of these psychological, emotional scars. Like say, if you're getting in a car wreck, then you're going to feel all the rush of emotions, like all the rush of your hormones and neurotransmitters that are going through your body. And next time you're going to be in a car, you're going to feel that same fear that you felt when you were in that car accident, right?
yeah,
So that memory is going to trigger that physiological response, and your body is going to feel the same way. But when you're a baby, a toddler, these memories are not being set, but these emotions are being felt. So your body is developing brain connections that are going to stay in your brain for the rest of your life, unless you have some type of therapy to sort of change those brain connections. And that's what some of the current therapies do, like EMDR,
I
and all
I
these.
I'm, I'm familiar. What was it? Cognitive something.
Yeah, cognitive therapy. Yeah,
Yeah, I'm kind of familiar with that because
yeah. So
my
what that
my daughter
aims,
had some of that, and I've kind of read on that.
yeah,
Just and
it's
just
actually,
kind of
yeah,
rewiring your brain, catching yourself in that trauma response, and being able to find a way to cope with it in a healthy way is what
yeah,
that's
exactly,
the
and
goal.
it's pretty
That's the
effective.
goal. Yeah.
But without would that be without medication when you're using that type of therapy, or you could
Yeah,
still
yeah.
use
Well, I
okay.
mean,
It
if
could be
you
both.
need medication, yeah, if you need medication, then
It
definitely
can be
take it.
used
But
with
I
it.
mean, the
Yeah.
goal is certainly to be able to handle it without medication. And there's
Yeah,
breathing and techniques and meditation and whatever. I mean, it's all up to you. You got to like find how you get out of that.
Yeah. Well, for
Crazy.
for me, like I mean, I appreciate you sharing. That you think a lot of yours comes from not the neglect, but from just lack of what's the word I'm looking for?
yeah.
Being
So
lack of being present in your childhood, basically.
yeah, it
Where
doesn't necessarily have to be something that someone is doing on purpose. It doesn't have to be a neglect that somebody is doing, with the purpose of causing harm. Like you said, it can be from somebody's life circumstances. Like your mom was, in pain, right? So she was trying
Yeah.
to deal with her own stress and her own trauma. Your
Yeah.
dad was working a lot trying to support the family. It wasn't
Yeah.
they were trying to do it in the best way
Yeah.
that they could cope with. And
And
so,
that's a
but
good way to understand it too, because
right,
you can't really be upset and hate people because of the situations they're in.
Yeah. I mean,
When
because
they
they're
tried the best they could and they were loving and that's what
correct. I
counts.
mean,
But
and that's the
it
thing.
still has leaves a scar. Sorry,
Yeah,
Reggie.
well, no, no,
yeah,
it's very. I like that because it shows you that it it can give the same effect in terms of trauma, even when parents think that they're doing the best they can,
Yeah.
to be there for their children. It's not like your parents were. I mean, because you could have the same setup where a child could get the same trauma from a parent that's a druggie, that is purposely lacking giving their child any attention or not giving them what they need, and they could still get that same type of trauma that you can receive, even though your parents were trying to be there for you, give you a place to live, keep food on the table, and so forth.
Yeah.
So I mean, trauma can come out of a household that is physically together, or it can come from a household that's scattered and doesn't have that normal presence of a family. Does
yeah,
that make sense? I don't know if I'm explaining that correct, but to me, it's kind of an eye opening to see that trauma can come um, from a healthy environment, or at
yeah, and
least from an
most.
environment that you think was healthy.
Yeah.
Yeah.
When you hear the word trauma, you're thinking of, like, an accident or something that causes physical harm. But the majority of times, trauma can be like just something that you experience that your body perceives as harmful, right? Like I said, Gabor Mate says that it often happens in infancy, and at that time, a baby or a toddler can't really make any type of decisions for themselves. They can't really take care of themselves, so they depend on somebody else completely. And whatever is going on in the environment is what's going to ultimately shape their brain and the way that they eventually start to react to things. And so he says, there's this one thing that he always says that to me stuck with me, because it's really important for people to realize when they're older that it's not what happened to you. He says that trauma isn't what happened to you, it's just the wounds that that event left with you. So trauma isn't really the outside event, right? It's trauma is just whatever, since however your body responded to it. And that's why even in adulthood you can have two people, uh, even two siblings, let's say two people that were raised in the same house with the same parents in the same environment, but a few years apart, right? They were both babies in separate times, and then when they're adults, they can be in the same car accident and have the same type of injuries, and they both deal with
Yeah.
it completely different ways. Like one can go into, I don't know, become an addict, and the other one can be like become a, I don't know, spokesperson for whatever, right? Like one uses it, one breaks down from it, and the other sort of grows up from it.
Builds from it. Yeah.
You can't really blame the person for how they're reacting to it as an adult. You have to look at how their brains were shaped before they could even form memories or think for themselves or act for themselves. So ultimately, everything goes back to how those very first few developmental years shaped your brain. That's how your brain is going to perform for most of your life unless you do something about it.
But in terms of brain developmental aspects, like, so can trauma? I know you said as a toddler, but like, let's say after 5 and up, where you're actually able to remember, some of the things that you from your childhood, with the trauma that's inflicted on you during that time, is it the same as the trauma prior to that? Because one is just your brain learning how to react to responses but without remembering, correct? if you're
Yeah.
if you're 5 and under, and I guess 5 and over, where you're actually able to remember those memories vividly and things that actually like triggered that trauma, then is it still the same type of reaction that your body has, like the flight, what is it called, the life or flight reaction, like when you get
Yeah, the
anxious, like
fight
when
or
you're,
flight.
yeah, like when your body's like reacting to like a past trauma trigger basically.
Yeah, basically what happens when you're talking about the fight or flight response, that's your body using what it learned before age 5, how it got wired, and then it's responding to those situations that is being put into uh, at that specific age. That's why there's I don't know, there's kids that their pet might die and they might just be fine, and then there's other kids that their pet might die, and like I said, they have like a completely different response to it. But it's not to say that trauma doesn't affect you after age 5. Obviously it does. Like
It
if you're
does, yeah, yeah.
there's this um I don't know if it was a study or if it was just like a clinic where one of the doctors was saying that that pretty much every single addict, female addict that he had treated in the clinic had been sexually abused as a child, and so it goes to show that those experiences, those traumatic experiences, do shape who you become, even later on. So whatever happened before age 5 basically builds the foundation, and then whatever happens after that is still going to continue to shape your brain, because early childhood is really really just a time of complete brain rewiring and reshaping. So you can actually reshape the brain of a baby that was completely neglected, and who was very deeply affected by some type of traumatic experiences before age 5. You can change that as the child grows up, like Anthony mentioned earlier, with different types of therapies. So yeah, when you do have kids who have traumatic experiences that they can remember, they definitely affect
Yeah.
how they grow up.
Well, like for instance, with our son Ashton, I mean, he had his first open heart surgery when he was 6 months old, and he definitely wouldn't remember that, but yet that was severe trauma that he went through. It's,
Mhm.
open heart surgery is very traumatic. Um, so that definitely, we could assume that that has a lot to do with some of the diagnoses that he has in his life as a young adult. Would you agree with that, or would that not be correct to say?
No, yeah, there's actually a lot of research that shows that kids who this research is specifically for heart patients, for kids who have had heart surgery and have been through ECMO, which is where all of your blood is basically filtered out of your body through a machine. Um, but it does affect your brain and the amount of oxygen on it. So there is research that shows that kids who have had that type of surgery eventually do go on to develop conditions like OCD, ADHD, autism, and other types of
Mhm.
developmental issues. So yeah.
See, me personally, I've never been diagnosed with OCD, but yet I catch myself, doing things that I would consider as a person that has been diagnosed with OCD, like doing repetitive things, or having to like touch something, or do something a certain amount of times. Otherwise, I get, that thought in my head that something bad's going to happen. Um, I've been able to work my way through that without any type of, professional help. But I mean, it's still there. And I do remember
Yeah.
my father used to do things like that, it makes me wonder what type of trauma that he would have experienced that would have caused him to do that. As a child, I remember him, putting a top on a bottle, and he would have to, do it several times before he would twist it completely, and make a sound as he did it. And I mean, it was just small things like that are
Mhm.
repetitive, which are OCD ticks basically. Um, is that something that can be genetic as well, though, or would that only be something that you that you actually, what's the word I'm looking, that you actually
Develop.
like develop
Yeah,
over time.
develop based on trauma, or can it be something that you can develop without trauma? Do you
Do
know
you
the
have
answer?
anything on that, Anthony? Yeah.
Oh, no, I mean, I'm the same as him as far as I never really could get like help with any mental health issues, so I always kind of had to like self-diagnose and just find a way to deal with things myself. So
Yeah,
I
but
think I'm more of like ADHD, where
have you ever
um,
caught yourself having any type of like tics though, like things that you like in your head that you have to like do, or otherwise you felt like something in your life was going to go wrong, or like making sure you like every night go check the door to make sure it's locked, even though you locked it like an hour ago. Like, have you ever done things like
um,
that?
I mean, I think to some degree, I wouldn't say to where I think it's like abnormal.
Abnormal, okay.
No, I mean, I guess there's a regular amount, and then there's like
But
an abnormal,
for me, I noticed that
obsessive
mine
one, I guess.
started to appear back like after we started having to go through a lot of like hardship with our son
Okay.
Ashton,
Yeah.
when he was just before he was able to be diagnosed and put on proper medication to basically calm him down and make him be able to mentally be back to his real self. I mean, he was just a completely different person, and
Mm.
I think that drove my mental health to like to start triggering things that were there. All
Did you feel like you just like always had to be alert and like just was
Oh
it like just an
yeah,
overwhelming, just you had to have
yeah,
everything,
just overwhelming. My
I
my
can
mind
imagine that, yeah.
my mind is always busy. Like I'm
Yeah.
a worrier. My anxiety. I mean, you suffer from anxiety, so you know how that feels.
Oh,
Social
yeah.
anxiety is like one of the worst feelings ever, to have social anxiety. And I've
Yeah,
gotten a
it's
lot better with
mm.
it, to be able to cope with it. But I mean, it's definitely still there.
Yeah, I
uh,
have too. It's really hard to do it. Even growing up, I think like I was a really, really, really shy kid, and like my mom would always like talk to people for me, and like
yeah,
that never really like let me like
but
grow.
see, I was the
Yeah,
So
same
same.
here.
Yeah,
yeah.
I think all three
Well,
of us
yeah,
were the
you have
same
the
with
same
that.
issue. Yeah.
Yeah. And it makes you wonder though, like what trauma did we experience that caused that? Because I think social anxiety does come from trauma,
Yeah.
a fear of being judged. As
Yeah,
I was,
mine for me was my hearing, because I like early on, my mom didn't know that I couldn't hear, and to me it was normal, so I didn't realize that
Yeah.
not everybody experienced the world the same way that I did. So I think I was just diagnosed with hearing loss when I was like 10 or 12 or something like that. But I had already had hearing loss for pretty much my whole life. And so for me, it was like this huge fear of walking up to somebody and telling them something, and they will respond, and I will be completely embarrassed because I
And yeah.
heard it completely wrong.
And
Sometimes I
I'm the
will I
same
will
way
answer,
because
yeah,
mine is more of like a speech thing because I
yeah,
have so I guess I'm so overwhelmed with thought, or I'm in some other thought and I have to dig myself out of that thought just to come to the reality or whatever. I don't know if that makes sense.
no, no, I can
And it's
I
then
understand.
it's
get
a
it, I get
speech.
it.
Like I
Yeah,
didn't speak like when I talked, I kind of mumbled and people would be like, What'd you say? And
they
like
would it.
I didn't want to talk because of that. So I didn't call people. If I talked, they didn't understand what I was saying. Or if I went to go order food, they're like, What'd you do? So
Yeah,
someone else. And even when I was in a relationship later on and got married, that's what they had to do too. And so
So
I mean, it went on like that for like I don't know till just recently when I didn't have anyone to really do anything for me, so I had to just do it.
so we have Ketchup Monsters who joined us, and he said, "Who's that handsome guy with the glasses?" So
you getting hit on
Like, that
already,
must be
man.
me. I have.
Do I put my glasses
I
on?
do. Oh yeah,
if
put your glasses on.
so if you're just joining us, we have Anthony with us tonight on this live, and he's an old friend. We go back 30 years, I guess, maybe.
Oh, high school, yeah.
Yeah, so we grew up together. We were yeah, we were crazy. So
Pretty crazy.
we're discussing a lot of topics about mental health. I kind of wanted to get back to where I was going. So I think my social anxiety stems from my childhood. Like I thought back today, like really, really deep back, like when was the first time that I felt that I was judged in school, where it made me not want to go to school anymore. And now that I think about it, it was when I bought a pair of boots with my grandma, and they weren't regular boots, but I was a kid. I think I must have been in first grade, and I liked the boots. I thought they looked cool. I didn't know they were boots for girls, and I bought them, put them on that morning. I was super excited to wear them, to be able to you go to school in your new shoes, man. And then all the kids started making fun of me, telling me that I'm wearing girl boots, man. And
Yeah,
I think that just like I think that was the first time I experienced bullying. Now that I think back on it, and
yeah,
kids can just be so mean, but it sucks that something that little, I think, has affected me, or caused trauma in me, for all those years. And I've never like looked back far enough to even think that that moment would be something that could affect me. But now that I'm learning more about how things in your childhood do affect you when you're older, and actually maybe some of the issues of why you have some of the mental health issues that I have, or people do have. I mean, do you think that could have actually affected me, AJ? Like, how do you feel about that? Like, would that be a
Oh
big
yeah,
enough moment
yeah,
to cause trauma to me?
yeah, absolutely. And this is something that is it will help so much for people to be able to properly deal with all the trauma that happened to them as kids, as babies, as even the things that they can remember, obviously, because we can't remember, like I said before, five. So the things that make us who we are today, based on the memories that we do have. If more therapists were trained in trauma mental health care, right? Because it's completely different. Like I mentioned earlier in the show, there's a big difference between dealing with the behavior, with saying, oh, you're taking drugs, or oh, you're doing rituals for OCD or whatever, and to treat that behavior without treating the underlying cause, because when you don't treat the underlying cause, it's going to keep coming back. So it would be so awesome if we had more therapists that have the training to do trauma care, and help people connect with what happened to them and how to deal with that, and how you move forward without repeating the same behaviors, because behaviors are just a symptom of of the trauma, basically.
yeah.
So
It's
I had a really good therapist recently where I went through something, and she had me go through all these steps and like think about, uh she would ask me to look at what I was doing today and how that was connected to something in the past. One example would be like, having long hair, right? Like I hate having long hair, but I've had long hair my whole adult life. Why do I have long hair when I hate long hair? So she was like, you gotta connect that to something that happened to you. And what I kept thinking back to is my mom used to hate cutting my hair. She would not want to cut my hair because she wanted me to have long hair, because she said it looked girly and it was feminine, and I was a girl. So for me, that pressure as a kid of having to not be myself and be what my mom wanted me to be was so much that it caused me like stress and anxiety. And so when I was older, I felt like I had to still continue to follow that rule of having long hair, as to not to break that relationship. And earlier on we were talking about Gabor Mate, and he has this really really great talk about what it's like to be your authentic self, and how that connects with or attachment with other people. I don't know if you guys want to watch some of that video, and we can comment on that, or we can
Yeah,
save it for
we
later.
can. But can I just say make a
Yeah, go
response to
ahead.
that? Just what you were saying with the long hair thing. So I do understand how that definitely causes, you to believe that you can't be yourself. So then you try to live how other people will accept you, basically, right?
Yeah.
Or to make other people happy. So
Yeah.
I think, like with the boot thing, I tell you, I know it seems so simple, but I think that was the first time that I realized that people are not accepting
Yeah, of
of
who you
of
really
of, of, the,
were.
of the of the real you. Yeah, I mean, if
Yeah.
someone would like I love those boots, and to me they were just freaking boots, man. And
Yeah.
but I realized at that point that I had to choose things that that everybody would be acceptable of.
Yeah.
That my classmates were not gonna accept me wearing those type of boots. I was considered to be I had to be a boy. I had to wear things that I'm a boy. I had to wear things that other boys were wearing, like Nike Air shoes, or if you were poor, you had some Voits, you were wearing the Voits. And you'd still get made fun of
Some
for
gangsta
wearing
Nikes.
yeah, you'd still get made fun of for wearing Voits to school too, man, if you didn't
Oh
have
yeah.
the yeah.
Oh yeah.
So I mean
Did
it was
you? What about you, Anthony? Did you have any of those type of experiences where you were, kind of felt that you couldn't be yourself because you had to fulfill everybody else's? I know you have, but gotta
Oh,
ask, gotta put you on the spot.
um, I mean, yeah, I really can't think of any. I mean, I have some. I can't.
Take your time.
okay.
I don't know.
So
I
we're gonna
even.
answer that question.
Yeah.
There's a question on this
Well.
side.
And
So, Catching Monsters was saying that to get back on topic, what causes different types of mental health problems? OCD, PTSD, ADHD, eating disorders, personality disorders, that we discussed OCD, but what about the others? And I have to say that to answer that is pretty much the same. It's the same process that happens. Um, and this is the reason why the majority of these conditions, ADHD, OCD, uh, other autism, all of these conditions are diagnosed usually in childhood, is because they develop from so early on, from before age 5. That's when your brain wiring becomes what it becomes, and so you become wired for those conditions, basically, and so there's really no escaping them unless they're dealt with. But I mean, the majority of people don't consider whatever happens to a baby to be something that will affect them for the rest of their lives. Like, they don't really think that way. That's something that's pretty recent research that has been discovered. So, you know, back in the day, yeah, like it wasn't seen that way. It was just seen as, oh,
Yeah.
you're just crazy, or oh,
You're a
you're medication,
weirdo.
you're a bad person. Yeah, like you're not the normal, you're the abnormal one.
Yeah.
But that
I'm
that's that.
thankful that people, people, at least my kids get to like grow up in a world that at least somewhat understands that, and that's pretty
Yeah, and I
awesome.
think that
yeah,
this,
that
yeah, like what we're doing here, like having these conversations and letting people know, hey, it's okay to talk about it. It's okay to not be the normal. Like, it's not really abnormal. Like, okay, if you think about it, I don't know, uh, if the majority of people in America suddenly started, I don't know, beating up dogs, then you will say, oh, that's the normal because it's the highest number of people are doing that. Does that mean that that's right? No. So
Yeah.
normal isn't always a good thing. Isn't always a healthy thing. And abnormal isn't always a bad thing, and isn't always an unhealthy thing.
yeah,
So
that's
I
very
think that's
true,
one way
very
that we
true.
could look at it.
Well, I think that Anthony has to leave the chat here. We really do appreciate him joining us today for this 30 minutes, and so it's been a great conversation, and I hope
Uh,
that we can have him back on for some other topics because I know I'd really love to pick his brain on a lot of things.
Yeah,
Yeah,
I don't know if I can get used to doing this and just open
absolutely.
myself up and everything, then we can probably have some
Well,
decent conversations. So we'll
I feel
see.
privileged that you joined us this evening on the
Thank
live.
you.
Definitely.
I
Um,
enjoyed myself.
yeah.
Nice to see you
So,
again.
all
Awesome.
right,
Yeah,
all right,
yeah, we really always enjoy talking to you, so we would love to have you back.
All right.
and
Thank you.
we'll talk to you later, Anthony. Appreciate it.
All right.
All right.
Bye.
All right,
All
so
right.
we're gonna continue for a little bit, right?
Yeah, we are. Yeah.
You and I. Okay. So I just wanted to put this video on just because it's really, um, I think it's gonna be really useful to what we were just discussing, and it talks about some of the stuff that we mentioned regarding how somebody feels accepted by society, by their friends, by their family, and so I think it's a really important thing to talk about and mention. I'm gonna make it big. It's not the whole speech. I'm not gonna put the whole talk simply because it's uh so long. Okay, I'm trying to make it a widescreen, but it's not working.
That looks
You
okay right
guys
there.
will have to just watch. Yeah, just want to turn it up. So this is Gabor Mate, and he's talk the other part of the speech was talking about his story, and right here is when they ask him about specifically about authenticity. So I'm gonna play that little bit.
Need for attachment. This is a word that you deal with a lot. Tell us about attachment.
So this is a conflict that is probably central to my work in all manner of conditions and in all kinds of situations. It's a very powerful dynamic in adult relationships, for example, is the child has an absolute need to belong to the parents and to be cared for by the parents. That drive to be close to somebody in order to be taken care of, or to take care of the other for that matter, is called attachment. And mammals are creatures of attachment. They can't survive without attachment, without the caring relationship. Obviously, the young cannot survive. So attachment, that's fine. But then we have this other need that's also determined by evolution, which is I call authenticity, and just auto the self, so authenticity, being in touch with ourselves, being in touch with our feelings and our bodies and our emotions. I know last time I spoke here, I think I asked the same question, but let me do it again. I think I did. If you've had the experience of having a strong gut feeling about something and ignoring it and then being sorry afterwards, just raise your hand, okay? Well, see, the vast majority. What you're telling me here is about your childhood. Because gut feelings are essential for survival. We evolved out there in nature. For millions of years, the humanoid ancestors of our species lived out there in nature, as did our own species live out in nature for most of our existence as a species. Like out of the 150, 200,000 years that Homo sapiens has walked the earth, if that can be represented in 1 hour, then until about 5 minutes ago, we lived out there in nature. How long does any creature in nature survive if they're not in touch with their gut feelings? So that being in touch with our bodies and our emotions is essential also. Terrific. But what happens is if for the sake of fitting with the family or with a culture that doesn't particularly support our authenticity, we have to give up our connection to ourselves, our authenticity, for the sake of attachment. Then being inauthentic, being out of touch with ourselves, is how we survive. We're afraid to be ourselves because we associate being ourselves with a threat of being rejected. And so this means that for the rest of our lives, we're going to be in relationships where we're afraid to be ourselves, to really say what it feels like for us. Now, that has terrific implications. When I say terrific, I mean significant implications. A study I quote in the book, they followed 2,000 women over 10 years. Over a 10-year period, those women who were unhappily married and didn't express their feelings were 4 times as likely to die as those women who were unhappily married, but they did talk about their feelings. So that inauthenticity.
So
Or about
that
married
was,
couples.
yeah, that was really that the whole message about authenticity versus um, attachment is really important for people to keep in mind, because all of these anxieties and depression and suffering that we have, that a lot of people are experiencing today, it seems to me that is so accurate to what he was saying, that it stems from not being able to be yourself and not being able to be in touch with who you really are,
Yeah.
and to
Yeah.
show other people and to be able to keep those relationships uh, at the same time as you are expressing yourself the way that you really are. What do you think about?
Yeah, to be able to keep your true self alive, basically, while you're trying to juggle all these other people that you're trying to please, basically. That's the way that I see it, right? Is
Yeah, and I
that
think the dimension of survival that he talks about is literally about staying alive. And when you think about it, and this topic may be sensitive for some, so we're talking about self-harm or taking away your life right now. So I think that the survival that he's talking about to is connected so much to why a lot of people take their own lives. It's
yeah,
not just being depressed, but not being able to deal with the emotions because they're not uh, in good tune with their own body, with their own emotions, and how to handle it.
yeah, I see that point. I mean, definitely you feel, well, not being able to be yourself and always having to put on another persona is also wrong. And I think it builds up and builds up and builds up, and then you lose reality of the real of your real person of your
I think you're
you.
cutting out a little bit. I don't know what's going on with your connection.
Where did you
If
go?
you're able to hear me still.
Okay, now I can hear you. You disappeared on me for a minute.
Oh, really? Okay,
Yeah.
that's good.
Oh,
Yeah, I think yours is the one. Well, it seems that yours is lagging. It's a little bit. The image got a little bit blurry.
yeah. How are we now,
And
guys? Is it still looking bad?
the chin monster says you're lagging.
Let
If
us
you had
know
anything open, you might wanna.
if it cleared up. All right. Well, I'm gonna start back over then because I'm not sure if I got
No, I think you're good. Yeah,
it
but
on.
you didn't. We didn't hear you before, but I think
So
we can
so
probably hear you now.
for me personally, like I've experienced depression based on having to based on connect losing the connection to my real self, I would say, not being able to be your real self enough during the day, where you only have, maybe 1 or 2 hours where you can truly uh, decompress and let that facade go away and be yourself. And when you don't have that, then you start to lose connection with your own self, and you become depressed. At least that's how depression always catches up to me. um like I think I've discussed before, we have different personas that we present. My main persona would be my work persona, and we spend majority of our time at work, unfortunately, when you have to provide for a family. Just like Anthony had stated, that his father, was always working. um, and sometimes you have to just take a moment to realize that, and breathe, and realize that yes, work is important, but it's not the most important part of you. um, Remembering the connection to yourself is, and with your family, uh, and being able to be your real self is very important, because otherwise you'll lead yourself into a dark pit of depression. And I've been there before, even though I know that is the reason I go into depression. But it's hard to not be able to get away from it sometimes.
Yeah.
um, what really caught my attention was at the end of that video where he talked about couples being able to express themselves with their spouse. Because for me, when I build up all of that and I don't share that with you, or share that with somebody, which it's normally you that I would want to share it with, um, sometimes I feel like I don't want to share it because I don't want to I don't want to bring you down into the into that same level of depression. But then I realize that if I do share it with you, that it's a huge relief off of my mind. And it helps me reconnect with it lets me reconnect with who I am, because you know the real me. You know who I am. You know that I can get overwhelmed, just focusing on work. And you forget to actually live life and be yourself.
Yeah, and I think that's ultimately what we just said, that is being able to be yourself, even if it means sharing the darkest parts of your days or of your life, or your emotions, or how you feel. And for you to be able to share that with that person, and for that person to react in a way that lets you know that they're telling you that it's okay, that it's not, that you're not pushing, they're not, you know whatever you say didn't push them away, or that they're not looking at you as less than, simply because you share that. Then you're getting both of those needs met, that we just watched in the video, right? You're getting to be yourself, and you're getting that person to accept you and build that attachment. So you get both the authenticity and the attachment.
Yeah.
And as he mentions on the video, that's like one of the most basic needs that humans have in order to survive and to thrive, is to be authentic and to be attached. Because all humans are extremely social creatures, and when we don't have those attachments, whether it be with a partner, with a child, with a parent, then that's when we start to isolate, and when we start feeling that breakdown of not having any type of attachment. But,
Yeah.
but that's why some people um, sacrifice their true selves in order to keep those relationships, because they feel like they have to put one above the other, and whichever they put above the other, they know that they're going to lose that other one. So they have to prioritize and figure out which one to put first. And I think that it will be so much better if the world were a place where we could put both at the same level. But the only way that that's going to happen is if people actually begin to accept others for who they actually are, no matter whether,
Yeah.
like you
Yeah.
said, whether they're normal or not. Whatever, like that discussion that we had earlier, that there is no normal. There's just variations uh, of humans. So we should all be more open to accepting other people just for who they are.
Yeah. I think that is a really key factor in it, just acceptance. I mean, that's always been one of my key fears, through childhood, all the way into adulthood, is just acceptance. And thinking, am I going to be accepted? Are people going to like me? Are they going to laugh at me? Are they going to think I'm weird? Even though in my mind, I feel that inside I have confidence, but outside I don't have confidence.
Yeah, and I know we discussed earlier, about the different types of depression, and I have to say that there is depression that is a chemical imbalance, and then you have depression that comes from our circumstances. And one of the things that I wanted to bring up is the example of this acquired depression and thoughts of ending your life that transgender people experience. And it has a lot to do with what we just discussed with authenticity, because they feel so deeply that they're not going to be accepted, because they know they're not going to be accepted, because society doesn't accept them. And a lot of times, even their own family doesn't accept them. So they have to sacrifice being the person that they know deep down that they are, that in their brains and their hearts that they feel that they are. They have to keep that hidden from the world, because they know that if they are themselves outwardly, then they're gonna lose out those relationships that they have. People are gonna look down on them. Family might cut them out. They might get kicked out of their home. They might, lose their partner. Uh, any relationship that they care about. And this is one of the reasons why transgender people have such a high suicide rate. And so, yeah, we need to work on making sure that the world understands the variation of people that we are going to have. And it goes for everything. It goes for the color of your skin, the whoever you are attracted to, sexually, like whether you're gay or straight, and your gender, like whether you feel that whatever you fit into the gender spectrum, that you're going to be loved and respected still, just the way you are.
I mean, as a human, I think that's what everybody wants is acceptance, and that fear of not having that, it can really, it can push you to, to that point to where you don't want to be here anymore. And it's definitely understandable. I mean, it's a sad, dark place that a lot of people live in when they can't be themselves,
Yeah,
and they're living in that fear, that either they have to be this person, like you said, it's making them choose whether they can continue to live as this person that they don't want to be, that everybody thinks they are, to keep those those connections with their parents, or to keep those connections with friends, or either they have that fear that if they want to be their true self and come out, that they're gonna be alone. And the thought of being alone is, I think that's one of the things that leads people
yeah,
to not want to live anymore, unfortunately. I mean, me personally, if we want to go back to that, um, I think everybody at one point has felt alone in this life. And I mean, it's a hard topic that most people would never discuss. But I want, if anyone comes across this video, or if anyone's watching tonight where they feel alone, you're not alone. You have people that you can speak with. We're here. You can reach out to us, Messenger, Facebook, email. Uh, we're here for you. You're not alone, for sure, because feeling alone is, you get inside your mind, it's one of the worst feelings ever. Yeah, when you think that no one else is out there and no one cares for you, nobody wants to, uh, nobody loves you, basically. As a human, we need to feel loved, in order to feel accepted. And
yeah,
I think we've all been there. When I was younger in middle school, I mean, I felt alone, and even though I knew my parents loved me, my parents were there for me, my brothers were there for me, but in my mind, I'd convinced myself that they didn't know the true me. I mean, I wasn't trying to come out as trans or gay, but I felt like, I'm not sure exactly what it was. Maybe I love my brother, my middle brother, but I felt like I was always in his shadows, where I was always trying to have to follow his footsteps. He was very, very smart. Well, he is very smart still, very good at sports. He was always great at sports. Um, I could play sports, but I wasn't great at them, and I felt
I feel you.
like I had to play sports because I had to I had to prove to my parents that I was just as good as my brother. And I think that that played a lot of mental toll on me during that time. And I did kind of in middle school, I kind of branched out away from that. Um, but then when I got into high school, I still had to follow my brother into like a an advanced medical school, and I felt like he wanted to go in the medical field, so I felt like that I had to go into a medical field too in order to to make my parents feel like I was worthy as well. When I had no interest in being a doctor or no interest in being a veterinarian, which is what I told them I wanted to be, and I was putting on a facade for them to make them love me when in fact it was just all in my mind. My parents would have loved me no matter what no matter what I would have wanted to do in my life. My mom and my dad, they would have been there for me. They would have supported it. But in my mind, I couldn't I couldn't see that. I felt that I had to continue to be this person that I created, you know, through middle school all the way into high school. And I think finally in ninth grade, I started basically failing all my classes, so I would get kicked out of the school. And during that time, I think that was probably like one of the darkest moments that I hit. And you know, I wrote a note, and I was ready to leave the world. And I'm glad I didn't do it because now I'm here today, and I have family still, friends. I know everybody loves me, but I think we all get to that point where we can not see or feel straight. You know, we're not. I don't know how to explain it.
Well, yeah, I think it has a lot to do with the way, like I said, how our brains are shaped before we know, right? So there's this quote that I heard earlier, and I thought it was good. It says, "Trauma is the wounds we acquire before our minds can make the world. We make the world we live in once our brain develops enough. Until that time, the world makes our minds." So what this means is that as infants, the world, our environment, our parents, our family, they mold our brains, right? And once that has been shaped enough that we become aware of it, then that's when we start shaping the world. And what happened to you could be, it may not be like we said, a specific uh, type of trauma, like what we think about, abuse or an accident or a surgery or something really physically harmful. It can be a parent that lets the baby cry it out. People think, oh no, doctors say that that's not harmful. It's fine. You gotta let the baby cry it out. But it truly is a connection that your brain is making. You're crying because you're whatever, hungry, tired, itchy. Like babies literally can't itch their ears if they want to when they're like 1 month old, right? So they're gonna cry because of that. And you may be like, well, I've already fed the baby. I've already changed their diaper. They're bathed. They've already slept. But what if there's something else that they need, right? And they're not able to verbalize that. So they'll cry. And the parents like, well, I'm just gonna put them down and just let them cry it out. Or when they're sleep training and the baby doesn't want to go down to sleep because whatever reason, and you just put them down and let them cry and cry and cry. What happens is the brain becomes wired to think that they're not gonna be having their needs met. And when they're not having their needs met, that's when eventually that becomes uh, a pathway in your brain. And eventually as you grow up, you start being more like, well, I'm out on my own. It's all up to me. And you don't realize where that's coming from. And you're like, well, it's just the way my brain works. It's just the way I think. It's just the way I feel, and it has a connection. Like even if we can't see it, even if we can't remember it, it always has a connection. So I think that what the way that you felt,
But
that you didn't fit in.
do you think that I should be at fault though because I didn't express myself properly to my parents to let them know that I was feeling
No,
that way?
because I think well obviously when as I've mentioned, your hippocampus doesn't develop until you're 5, right? That's the part that has your memories and other productions of certain neurotransmitters, and the prefrontal cortex doesn't develop until we're 25. So up until you're 25, this is the part of your brain that deals with making good decisions, with learning, with what is the other ones? I mean, you basically use that part of your brain to make reasonable choices and to process everything that you're going through, and be like, "Whoa, this is what I gotta do." And if you think about it, kids are experiencing pretty much everything for the first time. Like in a lot of situations, they're experiencing that emotion, that event, that thought, that feeling for the very first time. It can be anything. It can be the first kiss, their first time that they fell, or the first uh, time that their pet dies. And it's at different ages, at different stages. It can be anywhere from toddlers to teenagers. And when you don't have enough experience and enough knowledge, you're not gonna be able to say, "Well, this is what I gotta do. I have to tell my parents because otherwise." That's something that we expect an adult to teach a child, and it's one of the things that we're not really taught in school either. Like you're just kind of thrown in the deep end and be like,
Yeah,
just
yeah.
learn it now, figure it out,
Well,
you'll
yeah,
be
I mean,
fine.
I don't blame my parents for not, talking to me about suicide, it's a topic that, you normally don't think you would want to talk to your children about because you hope that you
They
always
don't
think
feel
you're
that way.
yeah,
Yeah,
you think that your kid's happy, but kids are so good at hiding things, and
yeah,
even when they're sad, I hid it very well, until I started acting out and wanting to fail my classes to get sent to a different school. And
yeah,
and even after I got sent to the other school, I mean, I got a little bit better because I did I connected with my friend Anthony that was on the show here, and we were both kind of we were in the same situation. I mean, we both I think had some of the similar feelings. Like we talked about suicide with each other, and we were there for each other. Like I found somebody that I felt comfortable to be able to talk about my feelings with in that sense. Um, I guess you just at that age you don't feel comfortable going to your parents and being like, "Hey, I'm depressed. I don't want to be here on this earth anymore."
yeah.
Because you fear how your parents will even respond to that because that's not even a topic that you've ever discussed with them.
Yeah, and I mean the issue with the teenage years is that, as I mentioned, the part of the brain that is meant to be making good decisions and choices and selecting, this memory with this response is still not fully developed. So your brain as a teenager literally cannot do the job that an adult brain can do. So you can't expect teenagers to perform and to behave in the same way that an adult would. And and also during this time, there's other parts of the brain that are developing, and the parts that develop way faster are the parts that deal with chemicals and emotions. So it's a highly unbalanced period of time. That's what we call teenagers, hormonal. And like one of the most important things to realize is that things like depression and anxiety can come strictly from uh, all these chemical interactions, right? You have you have, so we call them emotions or feelings, but they're actually just neurotransmitters. Like you have noradrenaline and norepinephrine, which is like adrenaline, uh, which deals with anger and fears. Then you have, and you know, like the fight or flight response that you mentioned earlier,
Yeah, yeah.
and responding to danger and responding to stressful situations. You know, serotonin is the one that makes you happy, that you feel joy. Then there's oxytocin, which is the one that creates bonding, and not just from it's the one that we always hear about, women releasing during birth, but it's also released during any other type of physical interaction that somebody has. Like when you give somebody a really good heartfelt hug, you know, when they're feeling bad or whatever, and you hold on to them for a little bit, that
Those are the
releases
best.
oxytocin
Yeah,
as well.
yeah.
When people have sex, they release oxytocin. And what this neurotransmitter does is it creates a bonding experience, a bonding memory of you and that person. So you're, anytime that you do any of those type of things, or when you're holding a baby, when a mom's breastfeeding a baby, they're creating that bond. And the more you experience that with the person, you know, the more oxytocin you produce. Then you have dopamine, which is the one that we talk about, pleasure and reward, the pathways. Dopamine is the one that's released when people do drugs.
Yeah, yeah.
And so both dopamine and serotonin are very deeply related to depression and anxiety. When the body has a low level of both of these, then that's when you're feeling depression. You're feeling tired. You don't want to talk to anybody. You feel heavy. You feel like a lack of appetite. You can start crying over nothing. And it also, when there is a very low level of dopamine, it's when you start feeling anxiety as well. So I think it's really important for people to remember that teenagers are going through a time where all of these neurotransmitters are just up and down all the time, and even within the same day they can continuously change and fluctuate and come up and down, and hormones and all of this.
Yeah, I mean,
So
that's just a bunch of,
yeah.
yeah, a lot going on at one time during the teenage years for sure. For
Yeah,
sure.
so we have to remember that they're not trying to misbehave. They're not trying to be rebels. They're not trying to be bad. They're not trying to make you feel like a horrible parent. They just don't know how to handle the change in their body and their emotions, and we that's when we have to teach them and give them the right tools to deal with all of these situations. And
Well, we have a question that I've had up on the screen for a little while here from Catch Monsters. He's asking, do if we think that trauma is the reason why people were not accepting of others. Um, I mean, I think that it could be a key point, you know, in some situations. You know, if people have experienced trauma, um, where it forced them to not be themselves, that they may lash out and not want to let other people's be themselves. I mean, could that be a thing? So
that
where
could
you kind of have
definitely.
kind of regret, basically, since they weren't able to be themselves, that they have regret, so they act out and are mean towards other people that try to that are capable of being out there and being themselves.
I think there's many factors that could affect why someone may not be accepting of others. And one of them is definitely, like you said, maybe not being allowed to be yourself. And then that sort of creates that connection where if you can't be yourself, then nobody else should be able to be themselves. But again, that goes back to how your brain was wired. And there's people that weren't able to be themselves. It's like we talked earlier. Why do two people deal with the same situation so differently, even though they were raised, you know, in very similar ways? And it always goes back to the very, very beginning and how your brain was wired to respond eventually. I was watching this really interesting documentary. I can't remember what the author was, but she's also like a neurobiologist or something like that. And she was saying that they were studying the brains of psychopaths, right? And how could they truly tell whether somebody was a real psychopath? And one of the things that they found was that there is a part of the brain called the insula, and this part of the brain deals with disgust and how we respond to things that may make us feel a certain way, right? Like I don't know, uh, if you don't like jello and you see jello, then your brain is gonna be like, oh, like you're gonna feel some sort of sensation like over your body, like you might feel nauseous. Yeah, like including smelling something that doesn't smell good triggers the insula, and the insula is also deeply connected to making decisions about moral uh, situations. So if you see somebody beating up a dog, the way your insula responds to that has a lot to do with how you're going to respond to it. If your insula becomes activated, then you're going to be like, whoa, that's wrong. Like that feels wrong. Like
Like
you're going to
morally, you
feel,
inside you
yeah,
feel it's
yeah,
wrong. Yeah, yeah.
yeah. You're like, there's people who see an animal being abused and they just cry, or they get really angry, and so it's a high response from the insula. And what they found was that people who were psychopaths had a shrunken insula, or they had, some of them had actually physically shrunken insula, and some of them had a lower um, response on their insula. And so what was happening was they were seeing somebody suffering, and their brain was literally not responding to it. And you can't blame somebody for how their brain works. Like you can't say, oh, if I don't like tomatoes, okay, I'm not going to respond. I'm going to eat the tomato. I'm not going to respond, right? Like your brain is going to respond no matter what. So to take the same situation and put it on somebody who is causing somebody else harm, and when you know that their brain is just not able to respond to it,
Yeah, it's not
then
capable of being
you're
able to
able to
respond to it.
understand, right? So you're
Yeah.
able to understand that psychopathy is not somebody's choice. People are not choosing to be murderers, they're not choosing to be, abusers. Their brain was shaped in a way from very early on, probably before they could even make any type of decision. Their brain was already wired that way. And they found that babies that were neglected and that were in situations where they were, very, very deeply neglected. I'm not talking about crying it out method, but
Yeah,
more
yeah.
like they were left, in their dirty diapers for hours, that were not fed well, that their parent they were left in their cribs for the whole day, or like they had no human contact, they had no love from their parents, they
But you're
had no
saying
care
you're
from
saying
their.
that like treating a child like that, do you think that can make
Yeah, they found that the studies of these people that were that had the smaller or lower response in their insulas had experienced those types of trauma
got
earlier
you?
on. So
So they do see a
basically,
relation, they do see a link to that
right. So they
basically.
were saying that
Yeah.
basically psychopathy is not something that you make yourself. It's something that is shaped into your brain without
Wow.
your
Wow.
ability
Okay.
to do it. It's kind of like the same way that somebody may be raised in this is why there's such a big push now for attachment parenting, because it works. So when you have a baby from the very beginning who is well cared for, well fed, all their needs are being met, then they grow up with that attachment. They know that they can go to that person and that person is going to meet their needs. And it's usually a parent, like a caregiver, mom, dad, whatever it is, a grandparent, whoever they're being raised with. It doesn't matter. It's, as long as there is a good attachment between the baby and that person, then the baby is going to grow up as an adult who has a safe place to go back to. Like they feel like, oh, I can talk to this person, I can share, I can be myself with this person. And it goes back to the authenticity thing, right?
But
So
do
they feel like they can deeply connect with that parent or caregiver and have that safety.
do you think that individuals that lack that type of attachment, as a younger child, do you think that they're more prone substance abuse or addiction, to use that as a replacement to cope, or to basically to cope and basically suppress those feelings of not having that attachment.
Oh yeah, it's definitely one of the main reasons why people. I was actually watching this other video, and maybe we could play a little bit of it, like just the beginning,
Okay.
where they were discussing this same topic about how addiction is not really a choice that people make, but rather,
Hold on. Can you? Oh, okay, that's fine.
yeah. Did you want me to do something?
I had to let our cat out. Sorry, guys.
Go for it while I set up the
No,
video.
no, he's good.
Okay.
Somebody opened the door.
Bad kitties. So
Not
let
that
me
I'm
see.
claiming to be fully cooked. And we're here at Penguin in England to answer some big questions. So the assumption in legal circles and throughout the whole, what's rightly called the criminal justice system, because it is a criminal system. The criminal justice system, in its criminality, makes the utterly unscientific, unfounded, and false assumption that people choose to be addicted. Now, first of all, I've worked with severely drug addicted people in Vancouver's downtown east side. The Western was the most notorious area of drug use, by the way, is in Vancouver's downtown east side. In my 12 years of work there, I met not a single female patient who had not been sexually abused as a child. Now, who the heck chooses to be sexually abused as a child? All the men had been severely traumatized in multiple ways. Who the heck chooses to be traumatized in childhood? The addiction then is an attempt to soothe the pain that's imposed by childhood trauma. Nobody wakes up in the morning and says, my ambition is to become a drug addict and break the law. I mean, think about it. It's a response to pain. Not only that, those traumatic experiences shape the brain itself, the physiology of essential brain circuits, in a way that'll bias that brain towards addictive behaviors, including with substances. I won't go into the neurophysiology of it now, but it's simply brain science. That's not even vaguely controversial. But of course, even physicians don't learn about it, let alone judges, lawyers, or prosecutors. Another point is that if we actually understand what an addiction is, we realize that drugs are only a small part of the addictive spectrum. I define addiction as manifested in any behavior that a person finds temporary pleasure or relief in, and therefore craves, but suffers negative consequences in the long term as a result of, but does not give up despite negative consequences. So craving pleasure, relief in the short term, harm, inability to give it up. That's what an addiction is. Now, notice in that definition, I said nothing about drugs. Yes, they could involve substances, some illegal, like heroin, some even more toxic than heroin, but legal, like alcohol. The definition also includes people who are addicted to gambling, to shopping, to eating, to work, to the internet, to pornography, to sex, to power, to a whole lot of other human behaviors. Why are we ostracizing a particular segment of the addicted population where virtually all of us in this particular stressful culture have some addictive patterns in our lives or have had? So
So, like I mentioned earlier, when when you have somebody whose brain was wired in a specific way to, is that my Alexa speaking?
Believe so.
Alexa, stop. Sorry, guys. I think when the dogs bark, it starts talking. It starts playing music. Um, yeah, I lost my train of thought. I think I was going with
Well,
oh, when people uh, are traumatized and their brain becomes wired in a specific way, then they're often experience depression because of that. And so this depression lowers your dopamine level. And what happens is that you need something to bring it up in order to be able to function, because we literally cannot function unless we have a stable level of dopamine.
yeah.
So a lot of people go into different types of behaviors that bring that up. They listen to music, they drink a soda, they drink coffee, something that we consider relatively uh, harmless. But other people go into other behaviors or substances that are a little bit more harmful, and like drugs or shopping or sex addictions or gambling, and so it becomes a way for coping with the lack of dopamine. So your dopamine goes down naturally, then you bring it up with whatever behavior, addictive behavior, and repeat, rinse, repeat, repeat, repeat. So
But
that's how
what
people.
but what is draining the dopamine? Just like everyday like worrying, everyday stress, those are all things that can drain your
Um,
dopamine level.
I was always it's like he was talking about how we respond to situations, and yeah, for some people it's definitely a little bit of the genetics to where their body just doesn't produce it, but then for other people it's more like wired into the response of their brain, like we mentioned earlier, when somebody is neglected, and so their needs are not being met, and so that kind of keeps that unhappiness feeling, and that level of dopamine just drops
Gotcha.
because you're not having your needs met, and you're not happy in the first place. So that kind of reach.
So
um,
then you seek alternative methods to bring that level back up, which
yeah,
some
yeah.
become
I
addictions
mean,
basically.
yeah, for some it can be like, even some do a lot of healthier things, like they exercise,
Exercise,
or
yeah, yeah,
right. So it's a more natural way of dealing with
yeah.
whatever trauma you had, or whatever peaks and valleys of the dopamine that naturally happen to your body. Uh, yeah, like we said, exercise, or doing, I don't know, traveling,
Yeah,
doing
things
things
that
that
make you
are,
happy,
yeah,
basically, or things that you
rock
enjoy.
climbing,
Yeah,
whatever,
yeah,
cooking, whatever
yeah,
somebody enjoys.
yeah. It doesn't actually have to be an abuse of a substance or an addiction
Right,
to
right,
bring those
right,
levels back up, but those seem to be the easier ways to do it without having to put too much effort into it. Like, I mean, um, shooting up heroin is fairly simple to do,
yeah. But
so
it's interesting because those external sources of dopamine can be really powerful. Obviously, you know this story because you lived it with me, but I'm going to share a little bit with the viewers. So I have a chronic pain condition called CRPS, and it's also called the suicide disease because it can be so painful that some people take their lives over it. And so I lived with this condition for many years before I was diagnosed, by like 10 years or so, until I was diagnosed. Then, when I was diagnosed, I was given pain medication, opiates, which is similar to heroin. It has a similar effect as heroin, right? And so my body became so used to that medication that we will have to, every few years, we will have to change it or adjust the dosage, or increase the potency of the medication that I was being given. And for, I think it was 2021 or so, I was given one of the most powerful ones, oxytocin. I'm sorry, oxycodone, not oxytocin, oxycodone. And so when I was given that medication, it's almost like morphine, and it's really, really strong. And what was happening was that my body was becoming used to that higher level of dopamine, and which was, unblocking of the opiate pathways that which help prevent the pain. So when it became used to that, then you needed something stronger. And so the body becomes used to utilizing that outside source, that external source, for producing dopamine, and it kind of forgets how to do it on
how
its,
to make it, basically. It forgets how to produce its own dopamine.
because it's getting it from somewhere else. And it's
Yeah.
exactly the same thing that happens to people who are addicted, right? They become used to it. They have to use more and more drugs, stronger drugs. That's why some people go from a specific drug to, something stronger like cocaine or heroin, depending on whatever they're using. And but so for me, when I was on these medications for 8 years. And when it came time to stop the medication, every time I tried, the withdrawal symptoms became so strong that I always had to go back and continue to use it, because I was not able to, I was not mentally prepared to deal with what was happening to me. And I think it was also a lot of fear of change and fear of the pain coming back. But I had found other methods, like with my diet change, that helped me lower my pain, and I was able to come off all of my other medications and my nerve stimulator and all of that. But anyways, I reached a point where I had to, it was do it now or never. So a couple months ago, I went completely cold turkey, stopped the medication, and obviously my body was just like, this is it. You're done. Like there was the dopamine level just crashed, and I think within a day or so, I think within 12 hours I started to feel it, but within 24 hours I was like on full blown withdrawal symptoms and sweating and high heart rate. My anxiety was horrible. I became like really deeply depressed. Um, I know my doctor helped me with this device called the bridge device, which you put in your ear and it kind of stimulates. It's kind of like acupuncture, sort of. So it helped with some of the physical symptoms, but it didn't help with the emotional part of it. It didn't help with the dopamine levels. It was just kind of helping with the nausea and the headaches, and that's about it. But so, as I mentioned earlier in the show, when your dopamine levels are low, then you can experience pretty severe anxiety and depression. And for me, it was that time where I just felt like there was, even though I knew that I had things to live for, that I had my family, my kids, my husband, my parents, my sisters. It was just like my mind was just okay. There is parts of the brain that are actually said to shut down when you're going through a specific either highs or lows levels of certain neurotransmitters. And for example, oxytocin, when you have high levels of it, they say that you can't make decisions, right? That's why people, when they're having sex or want to be with somebody that they want to have sex with, they are unable to make certain good decisions and they make bad decisions during that time. So the same happens when your dopamine levels are low. And that's why a lot of people with ADHD have such a hard time with concentration and executive function. It's because the prefrontal cortex, the part of the brain that makes decisions,
It just shuts down,
yeah, it may not completely shut down, but it's just like
not
so
functioning like it should. It's delayed.
that you can't really
Yeah.
make good decisions. So that same thing happens when you're having depression and anxiety, and so you know realistically, like the reasoning part of your brain knows that you have family that will be completely heartbroken if you took your life, but then that
But you
part
can't
of
reason
that
with it. You
decision
don't.
making part of your brain is just
Yeah.
offline, so you're
Yeah.
just like, that's not, yeah.
Like you
So
don't
it's
even realize, you can't even comprehend like the consequences of what pain it will
right,
bring
right, right,
to others, because
because you're not
you just
making the
can't.
connections. Yeah,
Correct. You
the
can't,
connections are just not being made.
see that. It's pretty much blocked
Yeah.
out. Yeah.
So this is why some of the treatments for depression include medication, because even though you may be replacing that dopamine with that medication, it sometimes the level of the medication that you're given is just enough to bring it up to where you can make those decisions and start helping yourself and start making better choices that lead you to more positive feelings of your body, right? And
And the more positive you start feeling,
right,
the more your body learns how to produce
yeah,
its own
like
dopamine again, kind of.
I went through like 2 weeks where I would just take off my cochlear implant and I would just sit in silence and just cry and not do anything and just lay in bed. And then one day I was like, I wanted to talk to somebody, so I talked to my mom, and I needed to have my sound on in order to talk to her. So I talked to her, and then after I talked to her and cried for like an hour, so I put on some shows that I wanted to catch up on, and I was like, hey, like, because she told me, try to do something for yourself today, like I love you and stuff. So I was like, kind of encouraged by her to do something other than mope around and cry.
Yeah, to try to bring yourself
So
back out.
yes, so I put on this video and I was just kind of half fast listening and just kind of trying to do some stuff around the house, but I was just feeling exhausted and tired and not motivated. And then all of a sudden when one of these videos ended and then a song came on that I really enjoy. I always talk about this, that it was a Green Day song. And it was I think it was 21 Guns. Like, I mean, it's a really deep song that you're just like, you listen to the words and you're like feeling connected to the
Yeah,
words and
you
the
really felt it.
emotions,
Yeah, yeah.
right? So I immediately felt like this rush and this rush of emotions, and it wasn't like negative emotions, it was positive emotions too. And so I felt like energized, sort of, and I was like, wow, okay, that feels good. So I started listening to the songs and put another song and another song, and soon after that, I found myself cleaning the house, and I was like, that energy that I hadn't had in 2 weeks was just slowly coming back. And so this goes to show that there, like I said, there are external sources that we can find of dopamine even when we are at our lowest. Whatever that might be for you, there is something that's gonna work for you, and you just gotta find what that is.
Well, I think music definitely, that could be a whole nother episode itself. I
Yeah,
mean, music has gotten me through some of the darkest points of my life. You know, I think a lot of people could probably relate to that as well. Um, Music is so full of feeling and emotion, and a lot of artists, not every artist can connect that way with music. I mean, with the music they make, but there's some music out there that is, it's just like, when you hear it, if it's the same emotion that you're feeling, you can connect with it instantly, and you can feel it, all the way inside, and it makes you realize that you're not alone. Music can make you feel
yeah,
like you're connected with someone that's feeling the same way, and it can lift you.
yeah. I mean, and everybody has different tastes in music, obviously, right? Like, you and I like uh, grunge and punk music, and I mean, we can even listen to other type of stuff, but whatever type of music somebody connects to, that's individual, but it has such a powerful effect. Oh yeah, sure. We stopped the whole hour and a half over. Oh,
Let me
welcome.
let me hit the rewind button like on a VCR. Wait, we don't have that. No, but thanks for stepping in, Skeptic Spin. Hopefully you can go back and rewatch the live show, because we've had some pretty good deep topics about mental health and so forth. And I
So
think,
one we haven't talked about is why it may be so hard. I mean, you and I were talking about this before the show. Why it may be so hard for men to seek mental health help. Uh, it's
we did.
obviously it's not every man, but there's certain personalities, I guess, of men, or the way that some people were raised to be.
I think
What
it
do you
is more
think?
related to the way that they were raised. More of a masculinity environment, to where men don't share their feelings, or men are supposed to keep their feelings in. They're not supposed to share, or tell, their friends they love them, and hug and express themselves with their friends. Yeah, we did discuss on this briefly, and um, it made me think to myself that I'm a little bit different, I guess, but I never grew up in a household that really expressed a lot of masculinity. It wasn't like this machoism, where um, where the man didn't share their feelings. So maybe that's why I didn't really connect to that aspect of that video. But I do understand that there are a lot of men out there that have grown up in that type of household scenario, or been raised in with those type of beliefs, and that definitely is not a good thing, because that's something that needs to be changed in the way that we look at mental health, in terms of men's mental health. Men should not be afraid to hug their friend, to tell their friend they love them. They shouldn't be afraid to talk about depression with their friends, or when they're sad, to tell their friends, you know, what's making them sad. They need to really be able to learn to express themselves, and not hold that in, because holding in that type of those type of emotions, or those type of negative feelings, it's harmful, very harmful, to yourself.
Yeah, I think you and I both learned recently with the experience that I shared about myself, and after that, you also experienced some situations where we are so resistant to change, and I think we learned that if we kept that in, then it wasn't helping either of us. And I think we both realized that communication was the key to moving forward, with a healthier relationship, a healthier life overall. And that's something that I think a lot of men are discouraged from doing, from sharing everything, from being open, right? So from telling uh, their wives about their days, or from talking about how something made them feel, from talking about their childhood, some of the experience that they had growing up. And a lot of them feel ashamed of the emotion that they felt during whatever event they were going through, right? Whatever situation, traumatic experience that they were going through at that point in their life, and they feel that because they felt sad, because they felt heartbroken, or because they felt emotional, or extremely happy, that that should be something to be ashamed of. And I think that's something that we need to break down and realize that all of us are the same kind of human. It doesn't matter whether what is in your pants. Like, you're still
It
human.
doesn't.
You
Yeah.
still make the exact same uh, neurotransmitters, that whether you're male or female, transgender, non-binary, we all make the same neurotransmitters. And even though some hormones may be in different levels, we still all have hormones that play with our emotions, that play with our feelings, and we all experience emotions, we all experience feelings. And one thing I learned from my therapy is something called radical acceptance. And it doesn't mean that you're going to accept that something is bad or whatever. You just accept that the feeling is there. You're like, okay, this is happening to me. What can and what can't I do about it? And you just accept it, as it is, as it comes to you. You don't try to uh, respond to it, to sort of reject it, or be like, no, this isn't happening, or why is this happening to me? It's rather like, this is happening to me. That's it. So I thought it was a pretty useful technique for accepting hard situations. Like, it can be even like if somebody passes away or something like that, you can't just focus so much on why they're gone. It's just like, okay, they are gone. Would they want me to, you know, completely lose my life, or would they
Yeah.
want me to continue my life? That's
Yeah.
that's sort of like the acceptance part of it.
No, that's a good coping mechanism. I mean, I've never heard of that before, but I could see where it could be useful in circumstances of extreme distress, for your mental health.
Yeah, I think on the topic of men being able to realize that they are also human, not just men. That's not their defining term. Their defining term should be human, right? And in the sense that we all experience trauma, then we are all going to be shaped by it, even men. So one way to treat trauma is to find a good therapist that knows how to handle those type of situations. Like I say, like we mentioned, how to connect what happened to you in your childhood to your behavior as an adult, because uh, it's just the fact that the brain, even though we are adults, the brain doesn't separate our childhood from our adulthood. We are one and the same. We're all
Yeah.
still babies. We're all still babies. The babies are still in our brains. So it's like we carry that baggage from our childhood in the shape of the brain connections that were formed during those early experiences. So we have to realize that in order to change that, the brain, we used to think, scientists used to think that the brain was, once the brain was shaped, there was no way to change it. But science has shown that that's not the case. There's
Yeah.
something
It
called,
can actually be
yeah,
rewired, basically, right? Is that what you're gonna go into?
yeah, it's called neuroplasticity. So it's basically the way that we can reshape those connections. And there is one type of therapy that I talked to Anthony about earlier, and it's called uh, EMDR, which is eye movement desensitization and reprocessing. So what this does is you go to a therapist that knows this technique, that's been trained in this technique, and that knows about childhood trauma, and they make you go through that situation again. Let's say, for example, sexual abuse or something that's pretty severe. So you're told that story, often in parts, and whatever parts are bringing up specific emotions. What happens to our body is when we remember something traumatic, our body is experiencing it all over again. So, whatever neurotransmitters were produced during that time, for example, adrenaline, right, the fight or flight, or it goes very high when you experience anxiety, anger, um, fear, danger. So when you're retelling or when you remember that memory, that's what happens with PTSD. When that memory is brought back into your brain, then your brain is producing the same neurotransmitters that it produced at the time that it happened.
When an actual
That's
okay,
that's
yeah.
why we feel trauma. It's like trauma is just like a wound, right? If you have a wound and you continue to touch it, it's gonna be hurting. So when you're recalling that memory, that harmful memory, your brain is reliving the whole thing and your body is feeling the exact same way that it felt at that time. So that's what trauma can be so strong, and it can bring such a strong response to people. So let's give him an example, right? A child that experience neglect, like we said, whether it be before they could set memories or after they could set memories, and experience that neglect, and they go on a trip, and they come back from a trip, and somebody's supposed to pick them up at the airport, and that person's not picking them up, or it's like, oh, I'm sorry, like call last minute, yeah, I couldn't make it, or don't even call, right? They just leave you there. The anger that you feel is connected to
To
that
the to the
memory of
to the
abandonment,
abandonment, right? Okay.
right?
Yeah, yeah.
You're feeling angry not because that person left you there, but because your mom left you when you were a baby. You're feeling refeeling that whole memory
Yeah,
all over again
it's
physically,
re-triggering those same feelings,
right?
basically. The
Your
same feelings
body
that your body remembered
brings,
from that,
yeah, your
yeah,
body
with your
brings up
brain.
the same level of neurotransmitters that caused you to feel that way, and so now you're mulling over it, and uh, that adrenaline just continues to flow, and so you stay angry. And there is a method that shows that mindfulness, like deep breathing and uh, bringing yourself back to a lower level of those neurotransmitters, can calm down that connection. And so where you can reasonably think a little bit better and say, okay, I am not angry because they're not here. Like, I can find another way to get back home. I can call a taxi, I can call another friend. It may take a little bit longer, but it's not a big deal, right? So you bring down that level, and you kind of start rewiring your brain so that it doesn't respond that strongly.
Every
But there is
time.
a
Yeah.
lot of people that don't know that this is happening. Like the current type of therapy doesn't teach people about how deeply connected trauma is to our current behavior. So people become angry, they stay angry, and then the next time that something like that happens, they do it all over again.
Yeah, they don't realize that it's coming from some trauma that could have occurred when
Yeah,
they were
and
a
that you
child.
can hear.
Yeah. Yeah.
Yeah,
But you really have to be able to think back
yeah,
and look at
connects it.
how your childhood was to connect that trauma to that reaction, basically.
Yeah,
Um,
there's some methods that also use um, the same technique, but they they work on responses that you may not have a memory of. Like I said, like before age 5, and you can say, okay, it's possible that there could have been situations that wired my brain that way to be reactive this way today, and so you're able to make the connection that something caused me to feel this anger that I feel today. Like I don't need to feel it that strongly today. Like there is really no excuse for it to be
yeah.
so
So
explosive.
So even if you don't know the exact thing that caused that
Right.
trauma, you're just saying that you need to basically work on that feeling that you see that keeps happening
Yeah.
whenever you're in this circumstance. Like for
Yeah.
example, even if you didn't know that you suffered from child abandonment, it could have been
Right.
something that happened before age 5 that you don't remember. But if you see that you're getting frustrated or upset or angry whenever some type of abandonment situation does come up, that you should be able to go ahead and put two and two together to realize that something must have happened that triggers that abandonment feeling, basically.
Right. Right.
Yeah.
Right.
Okay, I follow that.
Yeah. So there
That's
there
very,
are.
very, very interesting.
Yeah.
Very interesting.
Yeah. And it has been shown to work in people who have severe anger issues, like with anger management. So or severe anxiety as well. It works with anxiety as well. And the one that I mentioned, EMDR, is it does a similar thing, right? So it makes you go through that experience, through that emotional trauma or physical trauma that you went through, and you recall it. And then at the same time, the therapist helps you with they usually use something like a pen. It's kind of like hypnotherapy, but you're not being hypnotized. You're just using the eye movement. So as you're telling the story, then they're going like, you're just following the movement of the. That's why I call it eye movement desensitization,
Yeah, no, that makes
right?
sense.
So that's one of the methods that they use. The other one is the same way you're telling the story, and then they're using tapping, so you can like
For
tap
Phil.
yourself. You close
Okay.
your eyes and you tell the story, and you start tapping. That way, you're even though your brain is processing it, it's
But it's associated with another
reprocessing.
because it's
Yeah,
associated with another feeling, right? A feeling of
right,
touch, basically.
right,
Yeah, yeah,
right. Touch. Yeah.
yeah.
So it's using that to sort of reprocess that memory into a new memory that is not so severe. So eventually, the brain will associate the same memory that was deeply emotional at first with a lower level of emotion, and then the next time you tell the story, she does the same thing. Then the next time you tell the story, she does the same thing. And every time that you tell the story, it's a lower level of emotion
Yeah,
of
because
neurotransmitters
it
being
starts to
produced.
because it starts to connect it with that the new trigger, basically, for that
Right,
emotion.
right,
Yeah.
right. So
Nice.
it's a really interesting type of therapy, but it seems
Well,
to work really well. Yeah.
the sad thing is, though, like, therapies like that are not even well, at least in America. I mean, mental health therapy in general is just like so hard to get. I mean, it's not out there for people. You know, that if you don't have insurance, there's no way that you're going to be able to find or be able to see a therapist that would be able to
Yeah, someone
provide this type
that's
of treatment. They're going to send you a public or county hospital where you're going to see a basic doctor. They'll just prescribe you medication, basically, to try to cover it. or suppress it instead of actually treating treating the actual cause of what's causing the mental health problem to begin with.
Yeah, and it's kind of the same that happens with most other health conditions, like chronic health conditions, that are preventable, and it's treating the symptoms. People are just treating the symptoms, and they're not treating the root cause.
The root
Like,
cause,
let's
yeah.
say type 2 diabetes. Like, you go to the doctor and they give you or a medication or an injection or whatever. Not the insulin that you take as a type 1, but type 2 diabetes, which is mostly from lifestyle uh, acquired. So they're treating the high blood sugar with this medication that lowers the blood sugar, but they're not treating the root cause of it, and you're not actually reversing the condition. You're just managing the condition. And so what happens with the regular therapy that we have right now is that they're just managing the symptoms. They're just throwing pills at it and hoping that you stay good while you're taking your pills. Then you stop taking your pills and your condition's still there. But when you actually do these type of EMDR therapies or cognitive therapies, you're actually dealing with the root cause,
Yeah.
and you're learning how to rewire your brain, how to treat the actual how to reverse the condition, basically.
And that's what we need more of. I mean, we need to advocate for that. I mean, as a as someone who knows that this exists. I mean, there's so many. I would say that if you ask like a person on the street about this, they would not even have any idea what you're talking about. I
Yeah,
mean, this kind of stuff should be taught. It should be knowledge, for the public to be able to understand that mental health issues can be treated. It's definitely a sickness. We shouldn't just treat someone and just say that somebody's crazy, and they're a lost cause because they suffered from trauma. I mean, trauma can really mess up a human's mind,
yeah,
and their whole self in general. And I think people there need to be more people advocating for this type of treatment to be available to the public.
yeah, for sure. And I really think that it's not. And it's a shame that, for example, when you and I were looking for treatment for our kid, for OCD, we went to some places that had like a 12-month wait,
Yeah,
just
we
just
did.
for an introduction to a psychiatrist to prescribe, to make a diagnosis and
Yeah.
give a prescription, right? And I feel like both of us at that time when that happened, it was several years ago, like around 2020, and we did not know enough about mental health.
Any
And
of
so
that?
that's,
No, no, we
yeah,
didn't. We
I
didn't.
feel like
And
I made so many decisions that, had I known what I know today, I would have made completely different decisions,
yeah,
and offer different types of perspectives and stuff. And that's another thing that I think would be really, really useful. Just like people advocate for sex education in schools, there should be, I don't know what we will call it, but
mental
yeah,
health
there's mental health care, right?
education. Yeah, mental
Yeah,
health education,
yeah,
where
and
people learn about how all the different functions of the mind and how things can cause depression. I
yeah,
mean,
but
why do we have so many kids in school, high school, even elementary school, sadly, that are depressed. But it's a stigma. We don't talk about depression. We don't talk about suicide, self-harm. Those are all things that are not taught in school. I mean, if I had a class in high school that taught about self-harm, I would have I probably would have not have been cutting into my arm, or to feel better. I didn't have anyone to talk to about things like that, because again, we see it as a stigma, and it's something that definitely should not be hidden from the public. It's something that needs to be taught, needs to be spoken. People need to be outspoken about it. That's one of the reasons why we decided to do this live today, because we feel that it really needs to be out there. People need to know that they shouldn't be shamed or feel ashamed to say that they've been depressed, or to feel that they were once in such a dark place that they thought about taking their own life. We need to let those people know that it's okay, that there are people out there that have felt the same way, and it's you just need to be able to seek the right treatment to understand the underlying cause of where that pain is coming from.
Yeah, and the more we become aware of the fact that these issues are not just something that is just be called crazy about, that is just us being human. That's all it is.
Yes,
It's us.
yes.
It's biology. It's science. It's chemistry. It's anatomy. It's all of these science concepts all connected into one. And the more people learn about it and learn about the way the brain works, and learn about the way the body works, and the whole human anatomy is structured in a way that makes us susceptible to these conditions, right? To depression, to anxiety, to feeling helpless. And it's all about the neurotransmitters and the hormones and all of it that is flowing through our blood. That's all it is. It's not nothing to be ashamed of.
Not at all. Not at all. Well, we're coming up on 2 hours, everybody, and we're probably going to have to go ahead and bring this show to the end. I really do hope that anyone who comes across this video, or anyone who was watching with us during this live, that they enjoyed it, get some, actually learn some things from it. And if they know anyone who is struggling with depression, that they can actually reach out to those people as well, friends, family, and lend an ear to listen. That's awesome. Sometimes that's all it takes. Even just talking to someone and asking them how their day is going. I mean, that can help as well. Sometimes I think we forget, when we're so busy living our own lives, that we forget uh, to be, what's the word, to be kind to our fellow humans. Just say hello, say hi, how was your day, you are loved. Do you have anything else you'd like to say, AJ?
Yeah, I was thinking about someone that I know. He's a fellow YouTuber that I'm gonna shout out to. He has a channel called Your Friendly Atheist Neighborhood. No, neighbor. I'm sorry, Your Friendly Atheist Neighbor. And his name is Ethan Michael. And I recently found out that he has stopped making videos because he was struggling with a lot of mental health issues, and he shared some of it in his channel. And I always think about people like that and how we need to reach out to them, like you say, just reach out and check on them, and check on the people that you care about, that are going through struggles, and that sometimes they may feel like they can't reach out to you. But I do hope that some of them feel that because of this stream and this talk that we have today, that there is hope, that we can always come through the other side, and to get better, and that we will always. I don't think there's anybody that may have tried to take their lives who survived, that regrets it. I don't know, maybe there is, but I will say it's pretty safe to say that we are always grateful that we didn't go through with it. I know when I felt that way later on, when I felt that I wanted to not be alive anymore, then uh, when that passed, I was just so deeply grateful that I stuck around, because there's just so much to look forward to.
It's true. Just sometimes I think we're blinded by the good things that are going on in our life, because we're too focused on the bad things. But things, there is
Hope.
a light at the end of the tunnel. There is hope.
Yeah, and
And
there's people
never
that care for you. So
never forget that. So I wish the best to your friend as well, and hope that he can get back to where he needs to be.
yeah, hopefully we can have him on our channel one day. We can get to
That
meet him.
that would be great. That would be awesome.
Yeah. All right, guys. So we're gonna go. Thank you for joining us on Rage and Love, and we'll see you soon.
Y'all take care. Don't forget, like and follow, like and subscribe.